I'm Ashley Anderson here with Dr. Robert Harrell of the Harrell Dental Implant Center. Thanks for joining me.
Thank you. Glad to be here.
What is a typical reason someone might need just a single implant?
It's quite common in our practice that a patient might show up with a toothache. And what we uncover once we take a look at the 3D scan is that they have an old tooth that's maybe had a crown, it's had a root canal, and the tooth is beginning to break, it's beginning to crack, and it's failing. In those instances, we remove the broken tooth and place a bone graft the same day. Once that area is allowed to heal, typically for a period of a few months, we can come back and place a single dental implant and then restore that with a screw-retained prosthetic porcelain crown.
Start to finish, how long would a typical single implant procedure take from consultation to the finished product?
So that can vary a little bit. Let's say a patient had been missing a natural tooth, it had been removed more than 6 months ago and the bone had been allowed to heal. In that case, we can place an implant, in some cases the same day. We do allow the implants to heal. One of the things about dental implants is that they do require that the bone fuse to the implant. So think about this like a broken arm. Okay, if you break an arm, they put a cast on, they wait several months for the bone to heal, and then your arm's good as new again. Same with an implant. We place the implant, we wait a few months for the bone to fuse. We call this osseointegration. And then once that happens, we can build the prosthetic tooth really in a matter of hours. The patient comes back, we remove the healing cap on the implant, and we place an abutment on top of the implant. From here, we can use a device that allows us to test the integration. So we have a little digital tool that gives us a numerical reading, and it tells us if the implant is integrated or not, or what level of integration we've achieved. So once we determine that we have adequate integration, we place a scan post on top of the implant. We scan it with our CIRAC OmniCam system, and then with the CAD software that we have, we can design the prosthetic tooth, and we manufacture that right here in our own office, and we can deliver it to the patient within a couple of hours. It's that fast.
Is it a painful procedure?
You know, it's not, and this is also one of the things that's great about dental implants. A lot of these patients that we're treating, they're veterans to dentistry, so they've been through lots and lots of things over the years. When we start asking patients, how did this dental implant procedure compare to things you've had done in the past, let's say a crown or a root canal? Almost always we have those patients say, you know, this was so much easier than I thought it was going to be. There was no pain, the procedure was fast, it was quick, I wasn't hurting the next day, so it's really unique that we can provide something that's such a great option with so little discomfort for the patient.
And no root canals on an implant?
No.
Those days are over.
Those days are gone. In fact, root canals are disappearing rapidly, and we really start to evaluate now when a patient comes in, even let's say they have a tooth with a big cavity or a tooth with an abscess, and so we start looking at different treatment options. Well, one option in that instance would be, okay, we'll send you out for a root canal, we'll place a crown on it, or do we consider just removing that bad tooth? Let's cut our losses and go ahead and put in an implant that we know can be a lifetime replacement option.
Let me talk about the lifetime aspect. Once an implant is in your mouth, it's there forever.
Pretty much. What we're waiting for, like we talked about, was the integration period. So once we place the implants, we wait 3 months, we do a test on the implant to determine if it's integrated into the bone. And once it is, the likelihood that you'll lose that implant is virtually nil.
That's amazing.
It is.
Dr. Harrell, thanks for your time today. We've learned a lot of helpful information today, and I hope you at home learned something as well.